Hi everybody, good afternoon. It's Dr. John Hayes and welcome once again. This is another one of our midday lunch break videos. Today I want to talk about a recent study regarding daily aspirin, and I thought this was particularly important to discuss because there are so many people that do take aspirin on a regular basis, either on their own or the advice of their physician. So let's start out by saying that this is not a recommendation to start or stop taking aspirin, but it is something that I think is worth discussing and talking about with your doctor, and if necessary, make some extra time to have a frank discussion. But in any event, aspirin is a drug that's been around for a long time. The origins of aspirin are really probably thousands of years old, going back to willow bark extract and so on. And you know that it does have a lot of benefit as an anti-inflammatory. In fact, it was one of the first anti-inflammatory drugs. It also can act as a blood thinner, which is one of the most beneficial things for it, and it still is a very powerful anti-inflammatory. The downside of aspirin, of course, is it can cause stomach irritation, and ulcers if it's taken, for a prolonged period of time. I still remember many years ago when patients, for example, with rheumatoid arthritis, before we had the modern cascade of drugs that we do have to treat rheumatoid, for example, patients would be taking many aspirins per day and suffer the side effects of GI bleeding, stomach ulcers and so on. But in any event, the most recent study about aspirin highlighted something that is worth mentioning for sure, and the upshot is this, is that those patients that took daily aspirin for whatever reason were 37% more likely to have an intracranial hemorrhage, in short, a brain bleed, which can of course be devastating. Now, this is one study, okay? It wasn't a terribly large study, but to my read, appears to be relatively well done. I know a lot of patients have asked about this and doctors are aware, but again, I think that discussion is important by both doctors and patients, and I think that people in general should be aware before they blindly start taking aspirin because they saw this Facebook post, for example, that said you should take an aspirin every day, or an opposite post that said you shouldn't take aspirin every day. The reality is that every patient is different. All therapy has risk versus benefits. Doesn't make a difference which branch of medicine or which part of healthcare we're talking about, or for that matter, which illness we're talking about. All therapy has risk versus benefits. And good healthcare, good medicine is simply discussing with your doctors and acting appropriately. Okay? So again, caution, beware. Something we should be concerned about as both doctors and patients? Yes, I think so. So time to take a look at this and take a look at some of the alternatives available. For example, if you have been prescribed aspirin for thinning of the blood, there are some dietary changes and things that can be implemented that can be helpful. Also, keep in mind this, that aspirin can potentiate the anticoagulation effects of other anticoagulants, including things like fish oil. So the bottom line is be careful, all right? So do your homework, get good, competent professional help. As always, please post your questions and comments below. And if there's other things you'd like us to discuss, with regard to healthcare in particular, please don't be afraid to mention to us. And as always, thank you for your support. Well, take care, and we'll see you next time.